amazing explaining people what the craziness happening in my brain. And I didn't know that he did it. So this is a nice surprise. Thank you. So this is what my brain is thinking, what the slides were showing you with AI, and that's what my brain thinks, and to put on the paper so people can understand. So bring the normalcy here. So I'll start with you. I know you use Panomic,
Yes.
And before we met, we discussed it. So Panomic is a unique AI engine. So what are your experience from Panomic when you tried first? Be honest.
Well, can everybody hear me? I do. I've Welsh genes, so I can project very well. Hello? Can you hear me okay? No? Okay.
Check your battery.
Am I on? Hello?
We need AI mics. Yeah, that's the next innovation we have to make. Everything is automated.
I'm here. I would say if my daughter was here, she'd find it hilarious because I'd be throwing things by now. On one of my first slides, in fact, I removed it. Sorry, I talk about woo woo and calling BS on things. And so when I spoke with Dr. Port at the Royal Society in London, wasn't it, in medicine, we got chatting, and we had a really good chat. And he said, "You've got to try the software." And I was like, "Okay, I'll try the software." And I think this is rubbish. This is not going to work. This is just some guy. It's woo-woo basically. Who cares? And the team were amazing. I spoke with all the team, and the Bio team were just amazing. And I put it in the system, ran it, put some. I actually used 25 whole genomes, the whole exomes from my MS patients in Kuwait, and I put all that data into the system, and it did what it did. It did what it said on the tin. And the interesting part of it was that it actually cleaned the data very well. And this is old data of mine, old patient data, and I was like, well, it's just old rubbish data, and it doesn't really matter. Actually, it does really. But it's just stuff that was going to be okay. And so I put it through the Panomic system, and yeah, generated all the information that I needed. And since then, I've been kind of like seeing how we can actually use, and I talked about third parties with it in AI, but how we can actually run those in pipelines. And it comes back to how theorize the data as well. But the data itself, once it ran, I was amazed how it actually cleaned the data, which is something I need to talk to you about, actually.
Yes, he just joined our BioAero, and he came from Japan doing PhD in robotics and AI. He was training using AI how to train robotic systems. And the postdoctoral fellow, so he joined BioAero. We are given different tasks now. So he's supposed to be hacking our computer system against quantum. So becoming an AI to attack our system to see what happens. So that's what Panomic was. Panomic, when we built it, and people still don't believe it. People think it's rubbish. People think it's not possible that anyone can create a system that can analyze large amount of data in real time. And the system is so advanced, you cannot deploy it in many countries, and including Saudi Arabia, and including UAE. So they don't have a computing power. They have a data centers, but the computing power is lacking in many of those regions. So it's such an advanced, 10, 20 years ahead of science. The infrastructure we have today, Panomic is learning every day, becoming very, very smart. And it's quite exciting when I interact with it and get to learn from it. So I'm going to ask Jennifer, so you just came from Nashville, the land of all the music and the beautiful store there they have. So tell me your background, you're in supply chain, and tell me how you think AI is coming into supply chain side.
Okay, well, as long as we're going with Jennifer today, that's okay. Sometimes I like to go by Stephanie, but
Oh, sorry.
I'm totally good with that.
End of the day.
Well, let me know if I have more fun as a Jennifer or Stephanie after this. We're going to take a poll.
So end of the day, sorry guys.
Oh, yes.
So,
We're all the same here. We know what's going to happen now, don't we?
Well, by the way, dinner is coming, okay? It's a fun talk.
So I think what I'd like to start with is I'm going to touch on a little bit in terms of what Dr. Baker had talked about. And we are trying to build a healthcare system with a Commodore 64. So we are processing 64 kilobytes of information at a time, and we need terabytes. So the system is not built to manage what we're trying to build it with. So when we talk about strategy, governance, and risk, if you are a corporation and you're trying to run Excel with a Commodore 64 to do your budgets and your financials and your profit and loss, chances are it's not going to work. So we're trying to run a healthcare system in many countries, to John Warner's point, right? We're trying to disentangle the wellness layer from the sickness layer. And you can't do that when your operating system is a Commodore 64.
So what do you see the solution?
So the problem that we have to overcome to get to the solution is that silos are profitable, and we have a brick and mortar system that we have to pay for. So in order to disentangle that, you need a disruption. And we don't generally like to lean into disruption, right? Disruption makes us feel uncomfortable. And so we have to literally disrupt the healthcare system, and that's going to start, it's actually already started, right? We travel, right? I went to the US to get a stem cell treatment because I suffered severely from long COVID. Worked great. But I had to physically leave to go get alternative treatment elsewhere. That's going to continue until it reaches a critical mass where your current infrastructure is no longer supporting your base, and you either end up with a different government or a different space of disruption that's going to cause the industry to move forward. So we're on the precipice of that now because we already have a large number of people traveling to other countries to receive healthcare. And that's going to continue, and it's going to change how people vote. And I think that's where we're going to start to see more and more disruption.
That is true. In the US, now we have a new government, and Mr. Trump has hired a new health secretary who's going to be talk about loosening some of the regulations, and it has pros and cons both sides, but I agree with you, because there are patients suffering, and usually clinical trials are funded by pharma, and all the guidelines favor pharma, and other things are left behind with better funding. So I do believe I think it should be open. People should have a chance to try things in a safe manner. They should be informed consent at least. They should have a choice here, not as a limiting factor from a health perspective.
Completely agree. The other thing that we have to remember is that the FDA and Big Pharma are in the business of creating trials. And at, what did you say, less than 7%? 6.9% of clinical trials fail. Well, where does the money come? You know, when we're talking about 90-some% that, you know, don't ever work, those cost a lot of money. You have to still then fund all of that R&D. And so the big system of clinical trials, Big Pharma, the sickness program as opposed to the wellness program, that's what keeps you in that constant cycle because you've set that business up to run on that model.
That's true. So, Harish, what do you think? From investment perspective, you are into venture investment area. You see the AI growth happening. We understand where healthcare is moving. So, in the longevity side, investment side, so do you see people now investing more money in this area, and what kind of market looks like it in the future?
Yeah, so, can everybody hear me? So we love this space, I can tell you, and I could spend hours on it. I know we only have a few minutes, but you're seeing huge investment in AI and longevity. So, and let me just summarize a few of the steps. So, I mean, basically, you start with data collection and analysis. So you're collecting all this data from different sources, genomic data, so epigenetics, genetic data, all the IoT devices, AI wearables. You know, we've all got Fitbits and trackers and glucose meters and HRV monitors and all kinds of data. Then you've got hospital records. They all have different standards. So part of it is getting it all in the same standard. Once you've got that data, we're building predictive AI models based on algorithms and some of the things Bill that you talked about. And it's very exciting because you can, based on those AI algorithms, you can predict on a very personalized basis, changes in your health, what's good on nutrition or exercise or medical management and so on. And not only that, we're seeing cool things like companies are creating digital twins. So imagine every one of us having a digital twin with all that data real time, and you can simulate changes in your health and wellness with all of that. So there's a huge amount of investment going in these companies, and it's super exciting.
As Panomic has a capability of doing this large amount of data analysis, but it's all we call it uniomics. So through Panomic or multi-omics, so what challenges are you seeing before we start delivering it?
So challenges in multi-omics especially, I think the most important thing is to have diverse data, because I think other than this bioinformatics tool, whether it is BioPython or whether it is AI framework, TensorFlow or Keras, or the high performance computing cluster, there are other important factors like whether bias mitigation. So for that, definitely we have to ensure the diverse data should be there, and this data should be this AI should be explainable AI, helping physicians for consultation. So that is XAI, and then the compliance. So adhering all those, whether it is FDA or local regulations, guidelines. So I think all these three things are very important and challenging for our AI and Panomic development. So definitely we are looking for more and more data to be included in this Panomic or the AI.
So you like people to be doing more testing, people should be coming forward,
Yeah.
And they should be spending some time to discover more about them, right?
Yeah.
So this is how the data will be gathered.
So people not just not coming for themselves, but also the universities and academic institutions where the researchers are actually running thousands of samples. Even their data, if we can feed in this software, we can have diverse data, and that will help to get the accurate, whether it is personalized medicine or pharmacogenomic drug discovery, everything will be accurate if it is diverse. Other than this, there are different clinical trials. For example, inhibitors of interleukin-11 signaling pathway, or for example, beta nucleotide mononucleotide, nicotinamide mononucleotide, right? So all these, or the rapamycin and all those nutri-sensing pathway which is affecting AMPK or mTOR pathway. So all these targets which is included in the clinical trial. So if we can have all these data feed in the AI, definitely it's gonna help in the engineering.
So in the future, Panomic will be able to not only looking at genomic or microbiomics as an individual, we'll be looking at the same patient who's getting a epigenetic testing done, microbiomics done, and AI is looking at all the angles and connecting the dots and guiding us the drug therapies.
So in BioArrow, that's how we are moving forward now in Panomic, where we don't only rely on the genomic, but also having transcriptomic, epigenomic, absolute telomere length data, and also microRNA data. Then along with this, the proteomic, metabolomic, all those comprehensive profiling in this Panomic. Other than this, we will having the facial scan and all those variables data fit to that Panomic. So definitely.
That's amazing. So Daryl, you touched upon something about China. So tell us what you're trying to say.
Oh, yes. Has anybody been to the Chinese Biobank at all here? No, okay. Well, they have they built their infrastructure in between two mountains, basically. And so what they're using is the flow of air going through the mountain and going down. And so they have their biobank facility, and then they have their sequencing facility. And obviously the air's coming down and being pumped through into to cool that system. And then there's a 3-kilometer link which hits into a nuclear power station. And so, and in between that is a compute facility. And so what they're using is a really interesting natural lay of the land, for want of a better word, but they're taking natural airflow coming through. And what this is doing is reducing, I think we talked yesterday about using environmental friendly ways of reducing costs and reducing amounts of data. And this is one particular way that the flow of information or the flow of data, the flow of air is going into the system, and it's getting heated up at the compute facility, and then it's being pushed to the nuclear station to actually start the turbine. So it's an efficient use of energy, conservation of energy in terms of physics. So it's kind of a really impressive system, and to actually see it, it's one of these. It's kind of a panomics thing where you think, I don't believe this, but when you actually see it in place, it's like, wow. And to have all that infrastructure in place is kind of really impressive.
Very interesting. So, your story from a stem cell. So, tell how did you learn about it? Like, you're not from a medical background.
No, I have no medical background. So I was at a conference, a little bit different than this one. It was a lot of physical activity. We had to climb a mountain and do a bunch of stuff. And one of the gentlemen that was in the group with me had quite severe long COVID. He was bedridden. He had gone and had a treatment about 6 months prior to me meeting him, where he had stem cells and exomes and a Myers cocktail. And he had immediate relief, and then followed on by continuous relief, and he was able to return to normal work, right? So exercising, everything else. And I said, why, I keep getting sick. And he's like, you've got long COVID. And I was like, what is long COVID? And so he went through, he set up a charity to help people down in the US. I went to my doctor, she's like, I don't know what you're talking about. And so in working with him and looking through all the studies and the research and stuff that he provided me, I flew down, met up with his lab that he has down there, and went and had a series of stem cells and exomes. Part of it was nebulized and part of it was IV. And I had immediate relief, followed by I wasn't sick anymore, and I could actually go back to the gym and everything else. And so what's happening here is I actually can't even get in. It took me over a year to get in to see an internist. And the comment I got from them was, you should take some antihistamines.
Wow. So many people don't understand stem cells and exosomes, and there's a word thrown around for many people. And it's very complex science in exosomes. So essentially, they have to be frozen to minus 80 degrees Celsius, and when you obviously cannot give them to anyone in that state. So when you are warming them up, they start to die. So the room temperature, many of them die, but they still have a role play in regenerative medicine. We are seeing an uptake in pain management, in longevity, in aging. Many studies are happening in this area. So how long does it take for you to feel benefit? Like immediately, few days?
So in very immediately, like the next day. So I went from, as an example, I went from not being able to work out at all. I'd have my whole body would feel like I had a severe flu, like I couldn't move. And so the next day I went to the gym with this group of people, and I went on the rower for half an hour, and I was like, oh, I'm not gonna be able to move tomorrow. I woke up the next day, felt fine.
It's very powerful.
It was really powerful. It took a long time though to feel the full effect. I was going to say it's been like 6 to 8 months, but my neck actually feels great too now.
Okay, that's okay. So these are sciences which takes time to validate, but the patient experience is evidence. From Harish, from your perspective, so you're seeing the horizon of longevity medicine, exosomes, stem cells. What do you see when they're going to become mainstream? The challenges you see in this area?
I think they're starting to become mainstream now. Lots of world-class clinics. We opened one in Dubai just recently. And the problem is the costs are very high. So costs will start to come down as they percolate. But we're seeing, your stem cell story, there's thousands of stories like that. There's chirotherapy, there's full plasma exchanges. There's all kinds of, innovative treatments, full body scans in less than 30 minutes. And they're getting to be $149, and all of that data is, as you said, is being collected. So it's really fascinating how quickly it's becoming mainstream. And, there's a company in London, Nico, that does a full 360 scan of your skin, thousands of moles, early stage, so they can detect skin cancer. So, you know, it's going to continue to accelerate.
Well, and the future is exciting. I'm very positive about it. So I got a warning for a few minutes. So we will start to go towards wrap up. So, so tell me your experience about Liver Panomic, story a little bit. Before Panomic came to existence, what really was happening in the lab, and how it changed your life.
Yeah, so before we developed Panomic, we were using the other commercial software in the lab for analyzing. But what happened, any software, what I know so far, other than Panomic available, you get the list of variants, if it is whole genome sequencing data. And in that also, you need the reviewing because you don't know whether it is true or variant or whether it is false, positive, something. So the manual interventions is still needed there, as well as other than this, you need the annotation. So any software, if you see, is giving you the Excel sheet. After that, there are not many software which is doing curation for you for those variants where you have the annotation with the classification, whether it is pathogenic, whether it is benign or likely pathogenic, and associated to different phenotypes, as well as then you have to look into the ACMG guidelines and read it and do it. So that was taking long for us to generate the report and to deliver it to patients and clients. But then when we started developing our Panomic, and now as the main goal was to automate this process on Panomic and integrating this Panomic with all different databases, whether it is ScreenVar or other ACMG guidelines especially, and also what are the experts and literatures there. Accordingly, we have actually developed this Panomic to have the reports within just 15 minutes if you have VCF file coming out of high throughput sequencer, and in 15 minutes you get the long list of variants from whole genome sequencing or whole exome sequencing, which talks about the pathogenicity or whether it is benign or whether it is variant of uncertain significance associated to any phenotype. And if it is variant of uncertain significance, then if there is literature updated on that variant, then in 6 months, as we have genetic monitoring program in BioArrow 2, so you get another updated report in 6 months if you subscribe for that program, in which you can find out the more information regarding those variant of uncertain significance. So in this way, we found that we have expedited this process using our Panomic, automated Panomic. So there are various experts, whether it is bioinformaticians, lab people, or IT people, all AI, so all different experts, they came together. It's a big teamwork, but big thanks to Dr. Kapoor who supported us completely. And so now, yeah, we have very good software where we are taking out the report for whole genome sequencing, whole exome sequencing, pharmacogenomics analysis, and all microbiome, whether it is gut microbiome, skin microbiome, oral microbiome, or vaginal microbiome. So you upload the VCF and you get the results only in 15 minutes.
Amazing. Thank you. And this learning. So as Daryl, you talked about data and environmental footprint, but the world's most efficient data storage platform is DNA.
Yeah.
So how about putting data back into DNA? Because one DNA is equivalent to 100 GB data, and there's a large amount of data globally. Why don't we make a fake DNA in the factory, in our lab, and put the data back into it?
Well, I'm guessing you're probably trying to do that, but I mean, there have...
How do you know?
Because I tried it a few years ago. So I know you're going to try. It's a great idea because if you know anything about Oxford Nanopore technology and you see an ion channel, how quickly a sequence is read, they have to slow the channel down because when it's actually reading the data, but it's reading whole chromosome lengths of information within seconds. And so, and if they actually undid the chemistry and allowed it to go through the port, it would be ridiculously quick. And that's going to go down the rabbit hole when we talk about this, but that's a kind of interesting concept when it comes to using DNA or a potential form of nanopore using the ion channel approach for sequencing or looking at particular information or having some sort of 1 and 0. And if you can get the 1 and 0, then you get effectively you get an organic quantum computer, which is, I mean, that's science fiction, that is, but that would destroy, in terms of quantum computing, it would make quantum computing like 18th century technology.
Yes, I'm so excited. So the future is changing. I'm very positive about it. Otherwise, I would not be doing all those innovations, technologies, working and having this event. So I'll open up some questions for the audience at the end of the day and see questions people have. Please start by, There's a deeper discussion.
Hi, Dr. Kapoor, Jacques again. Dr. Kapoor, when it comes to the risks of false positives, for instance, in prostate testing and screening for prostate cancer, false positive sometimes leads to unnecessary biopsies, which leads to sepsis and problems. Is there some risk with false positives regarding sequencing, picking up potential cancers that might not be there, leading to colonoscopies that shouldn't have been done? Or where are we in that space?
It's a good question you asked, and so the PanOmic team, there is some experiment. So the lab-to-lab variation for a whole genome sequencing, if I take Daryl's whole genome and take to your lab and some other lab, and the same interpretation of the same human, sometimes come down to be a little bit wrong. And it's susceptible in the literature, up to 95% if you can match the interpretation, it's a gold standard. Most labs across the globe, they follow that. 90-95%, they say we are good. We are now open up a lab in USA, in UK, but there is something uniqueness happen in PanOmic. So what PanOmic did, so Meenal's team, so they asked the College of American Pathology, CAP, Global Regulatory Authority, in this area, asked them to send us a sample of a whole genome without knowing ethnicity of the person, disease of the person, could be a cat or dog or male or female, no idea. So they sent a sample and they ran a sample into the lab through PanOmic data. Interpretation was done and the data was shared with the CAP, College of American Pathology. And the team was expecting around 90-92% match. They said, would be happy. If we get it, we'll celebrate, open up a champagne. And I still remember, a report came back from CAP, and Meenal Mason calls me, and Dr. Kapoor, there is something I want to tell. I said, what? That we got 100% match. Singularity. So there's a man versus machine. So that's the competition we're talking about today. So not a single false positive was called out, not a single false negative was called out without even knowing the history of the person, without knowing anything. And that interpretation was done by a cat, by a human. And this is machine learning that called out everything accurately. You think of this way, 3 billion base pairs in one whole genome. So error rate could be significant, even 1% could be significant. So acceptable level, 95%, is outdated. We have 100%.
That's a game changer. That's
Yes.
a game changer there. I remember when you told me that, and I was flabbergasted. I was like, nobody gets 100%. And at that point, I was hooked. And I actually stopped doing everything I did because I needed to test this thing out. That's the importance of that 100% or even 99.9% accuracy. It's really important because what that does is it gives you confidence to infer concepts and a whole host of things in the AI. In the AI world, the garbage in, garbage out rules, because if the data's garbage, then everything else downstream is garbage, and it comes back to your false positives, false negatives, and hallucinations, and you get all kinds of weirdness happening. And when you said 100%, to me that was like literally a green light, but it was a red light for me to go, no, I need to stop and look at this because it's important, because it's fundamentally important. Really is fundamentally important.
Thank you. No, I called George at that time. I asked him, George, in Greece, he's a pharmacogenomic expert. I said, what do you think? Is the press release worthy? He said, of course the press release worthy news.
So I just want to add two things more to this is actually because our Phenomic is updating every time with last data set. This cap is not just once we are doing, we are doing twice in a year, so that every time we know and we are evaluating our process as well as Phenomic. So that's very good thing about it. And also, as you said, we can still review in Phenomic the results if you you get the automated report as well as you get the Excel sheets too with the long list of variants, whether it is 1,000 or 2,000, 4,000. So you still have that capability to review and to see and to edit the report. So we are there is no chance of missing anything in the report.
And, if I can just add something, just from an independent investor VC point of view, the technology of Panomic, there's a lot of companies trying to do this, and it takes days and hours and often much longer. There's nobody that gets 100%. So it's really quite remarkable. And what's even more is this is a Calgary-based company here, right here at home, and it's pretty incredible. So it's really world-class technology.
Thank you. And you were in Dubai when you launched it.
I was.
And people still don't believe it. So
They don't believe it because it's never, it's this company in Canada developing this. So it really, we need to elevate that.
Yes, thank you. Any other question?
I have a question.
Oh, sorry.
It's for Stephanie.
Yes.
Just wanted to ask you, as I've done quite a bit of research on long COVID, and in Canada, all we have gotten is support groups and, manager fatigue and, take rest, things like that. And you got the recommendation for antihistamine, so you're kind of ahead of us in that. But I'm just wondering if you wouldn't mind sharing the name of the clinic that you went to get the stem cell and exome therapy.
Yeah, so absolutely I can. I am just trying to rack my brain right now. It's in St. Louis, Missouri. Is actually where I went. And for whatever reason, I can't remember the name. I might go see the perimenopause doctor because I can't remember and recall things every once in a while. So that was I got a note here for that too. So two things on that. In the U.S., that particular group, it's called Fish Out of Water, and it's a charity. I can remember that one. And they do a ton of work, and they help a ton of people navigate some really cutting-edge clinical data, where they have some stuff that was, there's really small case studies and stuff, but there is some data. So it's Fish Out of Water is the name of the organization in St. Louis that I would recommend you to go see. And there actually are no more workshops or outpatient clinics for long COVID. They were canceled about a month and a half to 2 months ago. And so that work has all been shelved by Alberta Health Services. So, and actually I just want to give a call back to Harjeet when she was talking about her story. And I think some of the really profound comments we have up here are about knowledge of knowledge. And we're getting to a space now where we now know that there is knowledge of knowledge out there, and we're able to go find it. And through the use of different AI programs and protocols and experts such as yourselves in the building, because we now know that we can find it, it's becoming easier for us to access things globally and find solutions. And that was one of the things that I didn't quite understand when I was on my journey. I didn't have knowledge around long COVID. I didn't even know it was actually a thing until somebody told me that that's what they suffered from. So that's a really good question, by the way.
A question, I know there was a hand here. Yeah. Please.
So here we go again. We got your artificial intelligence is growing at an increasing exponential speed. And you have a lot more people doing this, and you have the machines helping you, and you're helping the machines. And meanwhile, what that means is that all the medical doctors have been trained historically are going to be left further and further behind, faster and faster. So my question to you is, how do you retrain, repurpose all those people that thought their careers were going to be great, they're going to become specialists and subspecialists, and all of a sudden they're going to be changed? And I've already seen a lot of pushback saying, oh, what's going to happen to me? So now we have what's going to happen. So how do you help us out here? Thank you.
I'll take this one.
Thank you.
But you know what I'm going to say. And we touched on this last night as well. It's called the 80-20 rule, but it's more like 95%, 5% really. But in terms of, I'm all sore there, but the amount of information that particularly pharma are dealing with, and this is cross-board, multi-omic data, you name it, they're spending an inordinate amount of time cleaning data, literally cleaning data, just so they can do some analysis on them. And so if AI can take that lift off, it allows the whole remit of medicine to sort of get ahead of it. And I talked about I'm at war with cancer, and one of the interesting things that we first talked about was turnaround times and decision making. And so if we can get a fast decision, we're not waiting 3 months, 4 months, having to wait for some sort of test, and we're getting that information. The reason why there's ADRs and errors in the system is because of this cleaning of information and cleaning of data. And I think to answer your question is it's going to take a lot of BS away from them and give them pertinent information so they can make a strategic answer.
Yeah,
The medical doctors that I've talked with say that you have Cyantra that can do a blood test for cancer right away,
Yeah.
and other kinds of tests, saying, "Oh, my career is over.
No.
What do I do now?" So how?
We talked about today where there was, or last night where there was doctors that there's a shortage of doctors around there. We had in the UK there's a company there's a point of care at bed where they're effectively allowing the patient to put some information into there, and that's freeing up. The nurses thought they would be out of a job because they were literally doing all their bed work and they're taking temperatures and all that kind of stuff was going to be taken away, and so and what it allowed the nurses to actually concentrate on the patients that needed that help, not the 95% of patients that didn't that were okay. They allowed them to focus on that. And in the UK there's a shortage of doctors, nurses, and everything. I think it's the same here in Canada. And what that's allowing, particularly from my standpoint, AI is allowing that concatenating of data, making sure that it's good information, so your doctors are getting the right information they can then act on.
If I can just add on that, so, you know, the careers are not over, they're going to be retrained. And they've got to be laser focused, and AI can read a CT scan far more accurately than a radiologist, far more quicker. So, you know, they've got to analyze that, and if they don't realize that, you know, they're going to get left behind.
Yeah.
it will be the doctor that will be using AI will be in demand, and doctor that will not be using AI will be jobless. That is true. Yeah.
Absolutely.
I just couldn't resist, but first of all, a fantastic panel. This is really, we're ending with a bang. The whole conference through has been incredible. But as a longevity doctor myself, I couldn't resist but just a brief comment. There definitely is information deluge for all of us. But the way I look at it, the way I conceive it and articulate it with my colleagues and those that I train, is AI is not going to replace us. We're needed more than ever.
Yeah.
AI is going to empower us, and moreover, it's going to empower our patients. And that's what we're here for. Frankly, making healthier patients, being the mission that brought me into medicine, if I could be obsolete and go into some other sector, I'm sure I'd never be bored. That would be a better world. But until that time, I think people are always going to want a human touch, and we're always going to need people who are most specialized in medicine working with the AI. And I'm excited about that future. Thank you.
Thank you. Thank you. So, okay, we have a question here.
And remember, there's all space as well.
So,
To include this one into the academic sessions, just to have some inclusion that AI is not replacing your career, but to enhance it. Yeah, so it's a generalized question.
please, I think she's
That's okay, fabulous question. So anyone in the world, anyone here heard of CAD systems? It's an engineering software system, it's electronic system. Has anyone heard of CAD systems?
Yeah.
Okay, everyone lost their mind. There's gonna be no engineers left in the world because they're gonna have AutoCAD. We still have a lot of engineers. What it did is it reduced the document control room, and now that document control room is no longer the entire floor of a building. It's 3 computers and 4 people and a database with terabytes of information, and you have electronic records, right? We can go back to when they started the first printing press, and the monks were losing their mind because who's gonna write the books now, and how are they gonna do their job? Right, so every time we have a technology advance, whether it's monks no longer writing whatever holy scriptures they happen to be writing because we have a printing press, or it's because we have AutoCAD for engineers, we all freak out because it's change, it's disruption. And at the end of the day, people are still needed. We are still valued. We are the only ones with that creative mindset. If anyone's watched Guardians of the Galaxy, you know that Rocket is the only one that can actually solve those creative problems. So we're always going to be required to be creative. What we're going to lose is the filling out paperwork for the 18th time by hand. What we're going to lose is the filing systems. What we're going to lose is these really redundant processes that, quite honestly, nobody wants to do. And AI is going to come in and it's going to automate those things, and it's going to free up our really smart people to do more creative activities as opposed to routine ones.
I agree, we'll become human again.
Really.
Thank you. So I'd like to thank everyone and they're coming. It's the end of the day. We do have a dinner at 6 p.m. Please do dress up and come back and we'll party. There'll be no talk and discussion. It'll be just dinner and relaxation and get to know each other. So we do have a summit contest. If you want to win a whole genome sequencing giveaway, you'll have to go to Instagram, hashtag CEO of My Health, and tag BioArrow, Longevity Summit, Longevity, and whoever does that, they're going to win the free whole genome sequencing. And if you're wearing the blood pressure monitor, or if you can do that, register for the blood pressure monitor 24 hours. Please take, we have nice flowers on the tables, so they are for you to take home. So please jump on it and register yourself and take the flower pot home with you. So at this time, I want to thank the Western Hotel. I would like to thank everyone in the team from BioArrow and Longevity who work day and night. And there's too many people to name, but definitely mention few who are present here: Dr. Dilpia Mangat, Honorable Leela here, Raman Kapoor, Prof. Simran, everyone, Raja, Dr. Raja Singh, Patrick, Neda, Francisco, everyone part of the team, cousins who are not here, some people online, Delavar and Alina. So a lot of people helped us along, made this happen locally and internationally. And there's one person who's moving her hand. Her name is Ruchi. So Ruchi, can you please stand up? So she's the cornerstone of the whole company, the backbone of the whole company. Please. So she's our chief regulatory officer and legal officer. She's a lawyer in Calgary, India, and in Dubai. And she gave the biggest sacrifice in our company. She is a single mother, so she took a task to go to Dubai and help us grow, help us guide this new regulatory challenges happening globally, and flew from Dubai again to Calgary to spend some time with us again. So without her, it would not be possible what we're doing today. The intellectual property, the patents we file, the trademarks we do. She looks after, her team of lawyers look after. So we are thankful to you. Thank you. That's it. Yeah, we'll have a panel picture, please.
That's never going away. It's going to be Thank you all very much, and we all hope to see you for dinner. And just to announce, we will be doing this again. And the next conference will be in May 2025. More details tonight, please come to the dinner. Thank you.
Thank you so much, and looks like it.